Hi, welcome to the channel. In today's video, we will be speaking about what is a low back pain, how is it caused, and what are the different types of low back pain. The reality is that 80% of us will definitely suffer from back pain at some point in our lives, and yet getting the correct treatment to reduce your back pain can be a frustrating and challenging task for you and your clinician. As you may already know through personal experience that back pain can be unique and complex, for it is difficult to diagnose and treat. There are many different types of back pain and a wide range of treatments that may or may not work for your back pain. The intensity and manageability of pain differs for every patient. In some conditions, the back pain can flare up and then subside, only to flare up again after a few weeks or months and then gradually intensify over time. Because only you know your level of pain, your treatment will most likely be more successful if you are an active participant in making the diagnostic decisions about your care. The term back pain is not really a diagnosis at all, but rather a description of a symptom. Some of the more common types of back pain, and many of you may recognize your own symptoms. Some of the more common types of back pain are mechanical low back pain, or low back pain because of a referred pain, or even your low back pain with radicular pain. Now, you may recognize some of the types of pain owing to your personal experience. Now, let's look at these three types of pain. Mechanical pain, which is mainly confined to one spot or region of your back. It can be described in many different ways. For example, a sharp or a dull ache pain which comes and goes. It is constant or throbbing in nature. A muscle strain is a common cause of a mechanical low back pain. Referred pain, often characterized as dull and achy. Referred pain tends to move around and vary in intensity. As an example, in the lower back, your degenerative disc disease may cause referred pain to your hip and posterior thigh. Radicular pain, commonly described as electric shock-like or searing. Radicular pain follows the path of the spinal nerve as it exits the spinal cord. This type of pain is caused by compression or inflammation to the spinal nerve root. In the lower back, the radicular pain can travel down your leg. It can be caused by conditions such as herniated disc, spinal stenosis, or even spondylolisthesis. In our next few videos, we will be helping you understand which kind of back pain are you suffering with and how you can manage your back pain. Low back pain with referred pain can vary widely with regards to severity and the quality of pain. It tends to be achy, dull, and migratory, which means it keeps on moving around. It tends to come and go and often varies in its intensity. It can result from an identical injury or problem that can cause a simple mechanical low back pain and is often not that serious. Referred pain is usually felt over the low back, and it tends to refer pain into your groins, buttocks, or even upper thighs. The pain often moves around and rarely radiates below the knee. This type of low back pain is not as common as a mechanical low back or even a radicular pain. Referred pain is a result of the highly extensive network of the interconnecting sensory nerves that supply many parts of the low back pain, the pelvis, and thigh. An injury to any of the structures can cause pain to be referred to any other structure. It is important to understand that this pain is not due to a pinched nerve. Unfortunately, the brain cannot determine the specific source of the pain. The distinction between a referred pain and a radicular pain is critical while we are diagnosing, and is critical because the treatment of the two types of pain varies considerably. A careful understanding of the history will tell you the difference between a referred pain and a radicular pain. Now, let us look at some of the ways of how we can treat a referred pain. The most important aspect while you're treating a referred pain is understanding where is the source of the pain and understanding which muscle is causing all the pain. Stretching of that particular muscle and its surrounding muscles will help you in reducing the pain, and using the foam roller will help you to go a long way in reducing a trigger. And finally, icing or applying hot pack to the area which is affected.